Bismillahirrahmanirrahim. Surgery a la file, first day of the surgery, and the topic is breast tumor. And page number soft copy 2. Okay, before discussing the breast tumors, their management, let's quickly just revise that what is BI-RAD classification. Yes, what is BI-RAD classification? What is BI-RAD score? 1, 2, 3, 4. What do you mean by? And according to this, we do have the treatment plan. BI-RAD 1 is the, what is BI-RAD 1? BI-RAD 1 is that patient do come to you with some symptoms, but you need imaging for getting an idea about the presence of the breast disease. Okay, so there is nothing to worry. Not this finding would be not significant. It would not be in the favor of breast cancer. In case of the BI-RAD score 1, the examination or the finding would be negative, and the management you would ask and advise for the routine screening. What are the routine screening? Like you would go with the ultrasound breast, you would go with the mammography, and the chances of cancer would be 0. In case of 2, there would be a lump, there would be a swelling that according to examination finding that would be benign. Again, you would ask for the routine screening, and the chances of having cancer would be very minimal, 0% almost. In case of 3, there would be a mass, there would be again a swelling. Then you would be having a tie between the benign or the malignant. So you would ask the patient for the short interval follow-up for the screening, 6 months. Short interval follow-up means twice a year. Every 6 months, you would ask the patient to come for the follow-up, and you would go for the routine screening test. Okay, because the chances of the cancer would be 0 to 2%. In case of 4, on the basis of your examination finding category, it would be in the suspected case of cancer. Suspected case of cancer, when you are suspecting some malignant tumor, how would we diagnose? According to histopathology. So the tissue biopsy would be required. Tissue biopsy would be required. Now, the chances of cancer would be from 2 to 10%. And the BI-RAD stage 4 is further divided into A, B, C. A, less suspicion of the cancer, 2 to 10. In case of B, moderate suspicion of the cancer from, more than 10% but less than 50%. In case of 4C classification, the chances of cancer would be more than 50% but less than 95%. In case of 5, category 5, highly suspected case of malignancy, tissue biopsy would be required. Chances of the malignancy would be more than 95%. 6, biopsy proven cancer, management surgical excision would be required. Okay, surgical excision would be required. I am sharing the table of BI-RAD score or BI-RAD classification. So it would be easy for you. Yes, have you received the image?
Yes, ma'am.
Okay. So They said first question is a female with the upper left quadrant lump. So according to the location, you have provisional diagnosis. Upper outer quadrant, lower quadrant, inner quadrant. Now, female with the upper left lump increasing with the time. Size is 15 into 15 centimeter. That is too much size, larger size. Ultrasound done showing the solid mass with the multiple cystic spaces with the posterior okay, with the posterior caustic enhancement. What is the management? First of all, this on the basis of the size of the tumor and the cystic appearance, this is typically a case of fibrocystic disease of breast. The other name of the fibrocystic disease is pyeloid tumor. Pyeloid tumor. We know that the breast would be large and bumpy. The surgical excision would be mandatory. The surgical excision would be mandatory because the size is too much. There would be a pressure changes, pain. So management would be simple mastectomy. Simple mastectomy. Okay. What is the definitive management of the pyeloid tumor? This is because you have only option. Like would you start the chemotherapy or would you go with a simple mastectomy? What is the treatment of the pyeloid tumor? Yes.
Ma'am, excision?
Yes, excision. But what kind of excision? Huh? There is a specific name. Shabash.
Wide local excision, ma'am.
Wide local excision. Okay. Fatima, welcome. Long time. Huh? Where were
मैम
you?
दिस क्लास टाइमिंग नो मेरे से वो एडजस्ट नहीं वो पर है मैम ओपी टाइम
Ah, could
मुझे तो
understand. Duty time. Yes.
5 o'clock बेस्ट टाइम था अभी वो 1:30
Hmm.
अब बहुत मुश्किल
Ah,
से
I
आई
wish
हैव जॉइन टुडे
I would switch in the morning with my duty roster because I reach home by 12 o'clock. So that's why I have to
इंशाल्लाह
pick up this time now.
इंशाल्लाह
But
मैम
inshallah.
हम वो जीपी फाइल करेंगे मैम साथ साथ में
Yes,
तब
yes,
तो आई
yes,
कैन
yes.
स्पेंड एटलीस्ट half an hour with the GP file at least by
Yes,
2
along
o'clock,
with this
2:30.
surgery, we do the GP file.
Okay, ma'am. Okay.
Okay. Okay. Female in her 47 year of the age, single positive family history of the breast cancer. Age 47, there is a family history. She underwent the routine mammography, which show the bilateral increased density and the glandular pattern. Core needle biopsy showing atypical ductal hyperplasia. Atypical ductal hyperplasia. What is the appropriate management? First of all, tell me what is this? What is this diagnosis?
Atypical ductal hyperplasia वो duct ectasia group के हो सकते हैं ना मैम
Intraductal? Yes,
papilloma
yes, yes, yes. So it would be intraductal hyperplasia. And since atypical cells are there, so there would be a suspicion of malignancy, atypical cells. So what is your management plan? Positive family history.
मैनेजमेंट हम मास्टेक्टमी करेंगे
Simple mastectomy, excellent. We would go with the simple mastectomy if there is a positive family history. If without family history, then we would go with the wide local excision. Wide surgical excision is what?
मैम व्हाट इज द डिफरेंस बिटवीन सिंपल मास्टेक्टमी एंड radical mastectomy
In the
हम किस
radical, yes,
सिचुएशन
in the
में
radical mastectomy, you actually remove some of the tissue from the axilla and from the pectoral muscles because you have to remove the lymph nodes, the lymph supply of that area. That is radical mastectomy. But in simple mastectomy, you would remove only the breast tissue, not the, you would leave the muscles behind, you would leave the lymph nodes behind. Yes. The next question is intraductal hyperplasia in the patient with the breast cancer, with the breast cancer family history. Now, intraductal hyperplasia, like intraductal papilloma. What would be the treatment strategy? अभी किया
Intraductal papilloma mastectomy, ma'am.
mastectomy,
Family
intraductal
hysterectomy.
papilloma with the, especially with the positive family history, with the family history. They already mentioned that there is a strong family history, positive family history. Okay, then you would go with the mastectomy. Upper left quadrant, increasing same size. This is again a phyloid tumor, large size tumor. And the typical management of the phyloid tumor is actually, phyloid tumor का management क्या है?
Wide local excision.
Yes. जहाँ पे भी, whenever you see the tumor, phyloid tumor, the management would be phyloid tumor, that you are already confirmed that this is a phyloid tumor. So we need a surgical excision. Surgical excision mastectomy, that is called the wide local excision. You would remove the maximum of the breast tissue in which the tumor was present. That is called wide local excision. Patient after modified radical mastectomy complaining of the loss of sensation in the inner side of the arm. Injury to which of the nerve is suspected? So, well, that is very common. While doing the mastectomy, there are chances of the injury to the brachial plexus. Which nerve of the brachial plexus? That is intercostobrachial nerve. Intercostobrachial nerve. Why? On the inner side. If they were saying that long thoracic nerve, there would be winging of scapula, symptomatic, but only the sensation on the inner side of the arm. So intercostobrachial nerve is responsible. A lactating mother came with the mastitis, inflammatory sign and symptom, an abscess of the 5 centimeter. What would be the treatment? If the size of the abscess is less than 5 centimeter, conservative treatment with the antibiotic. But if the size is 5 or more than 5 centimeter, then go with the incision and drainage plus antibiotic. What is the pathogen of acute mastitis, typically in lactating mother or breast abscess? That is Staph aureus. Staph aureus. Mastitis alone, without abscess, it's treated by antibiotic. Antibiotic. Cephalexin, doxycycline. Lactating mother, mastitis case alone. How would you treat? With antibiotic? You would go with the amoxicillin, you would go with the cephalexin. That is safe with the breastfeeding. A 26-year-old female with the left breast redness around the areola. Age is young. Redness of the breast around the areola. There is a mass in the right outer quadrant, tender and red. There is lymph node enlargement and patient is having high temperature. Typical case of breast abscess. Young woman, again, painful breast lump with the redness due to inflammation, tenderness due to inflammation. Temperature is high, 38.9. What would you do? If the size is 5 or more than 5, go with the incision and drainage. So it would totally depending upon the size of the abscess. If small, go with the antibiotic. A 40-year-old lady underwent the mammogram, ultrasound that is showing fibroglandular tissue, ultrasound showing the multiple cysts, what to do. And the BIRAD stage or score is 3. And I have just shared what is the management of the BIRAD 3. What is the management of the BIRAD 3? You probable, this is the benign. So you would ask the short follow-up. Every 6 months follow-up would be required. So answer would be this, short duration follow-up, 6 months follow-up. What is the meaning of the BIRAD 3? So probable case of benign case. So you would go with the short interval follow-up every 6 months. BIRAD 4. BIRAD 4 assessment, probable case of malignancy. So tissue biopsy would be required. So go with this core biopsy. Core tissue biopsy would be required. A 40-year-old female presented with the breast mass, teething, skin teething, typical signs of the cancer. Mammogram and ultrasound were done, showing the BIRAD stage 4. Probable case of malignancy, suspected case of malignancy, go with the core biopsy, tissue biopsy would be required. A 25-year-old female with the breast mass 2 into 2 centimeter described as oval shape, painful. Oval shape, painful. Age is 25. No other features of the cancer. Size is very small. Oval shape and this lump or swelling is painful. What do you mean by painful? Inflammation. So what is the best diagnosis? Ductal ectasia or breast cyst? Whenever you suspect the ductal ectasia, patient would present with the nipple changes. The nipple would be inverted. There would be discharge from the nipple. So this is not mentioned. So your best answer would be breast cyst. A young female complaining of the breast tenderness associated with the menses. Ultrasound done. Left breast showing 3 cysts. Right breast 2 oval masses. What is your diagnosis? Yes, typical cystic breast changes. Fibrocystic disease. Fibrocystic disease. A young patient with the breast lump on examination. Young patient, there is a lump, oval with a smooth surface and especially if it is mobile. Size is 2 into 2, present in the upper outer quadrant. That is typical case of fibroadenoma. Fibroadenoma, benign tissue, you would do nothing, just the reassurance would be required. 20-year-old female presents with a recent mass in the right breast that is smooth, that is mobile. Again, a case of fibroadenoma. No management, reassurance would be required. If size is larger, patient is symptomatic, then you would go with the excision, removal of that fibroadenoma. A 50-year-old woman, no family history of the breast cancer. One thing is clear. Mammogram is normal. When to do the next mammogram? Okay, now they are indirectly asking you, what is the screening age of the breast cancer? Yes.
35, ma'am.
What is the screening age of breast cancer?
35.
35. Yes. What about others? Wajid?
Sorry, ma'am.
What is the screening age for the mammogram? Breast cancer screening.
Ma'am, after the age of 35 to 40.
Hmm. What do you think, 40 or 35?
Before it was 40, now they have changed the protocol.
Yes, Fatma, what are you saying?
Before it was 40, ma'am. Now they have changed the protocols.
From 30?
No, ma'am. Now they have changed to 35. Before it was 40. From the age of 40, the screening of breast cancer was there.
Yes. What about in the MTB?
Ma'am, 40.
40, yes. Fatima, this is 40 international according to the American Association of the Breast Cancer.
Okay, ma'am.
Okay. That you are talking actually 35. वो आप किसके साथ कंफ्यूज कर रहे हो?
I think pap smear के साथ confuse हो गए.
हाँ, yes. So for the breast cancer, because this is according to the premenopausal staging now, so that is the best age to screen for the breast cancer. That is 40 years. 40 years. So from the 40 years, every year mammogram is required. So they said that patient has a family history. There is one question. Other question with no family history. And with the age of 50, the mammogram was normal. So next mammogram would be performed next year or every 2 years.
Ma'am, अगर family history के साथ हो, then every year we'll do mammogram.
Yes. And if the
अगर
without
family
family
history
history,
नहीं है तो once in 2 years.
yes, excellent. Okay, I am sharing a very good table that would help you in solving these kind of questions. There are many of the, campaign like pink ribbon or the breast cancer. Now you have you received the both table? Now look at this. If the age frame is between 50 to 69, between 50 to 69, and if there is no family history, you would go with the mammogram every 2 to 3 years. So best answer would be B, 2 years. Now the next question is 40-year-old patient with a history of the bloody discharge from the breast. From the nipple, there is bloody discharge. Number one, age is 40. On the physical examination, normal initial investigation, what would be? Would you go with the ultrasound or would you go with the mammogram? And when would you go with the ultrasound and when would you go with the mammogram?
Ma'am, a mammogram, if there is a strong family history, will directly go for mammogram.
Okay.
Ultrasound, अगर age कम है 40 से नीचे और they're having any lump where there is a query rise whether it is a benign or malignant, then we have to do ultrasound, ma'am.
Yes, Wajid and Ronak, what do you think?
Ma'am, I am reading gynae after 3 years. So I forgot everything.
That is surgery. Yes. If somebody presents with the mass, I'm not talking about only for the screening. if somebody presents with the breast mass, what is the initial investigation you would go?
Breast mass initially will go for ultrasound now. Because we doesn't know whether it is benign or malignant. So we can go for ultrasound, then we can do mammogram, right?
First best imaging for the breast mass, you think you would go with the ultrasound? Fatma, initially you said that if the patient is younger.
Yes, ma'am. If patient is a 30, 35 years old, अगर वो
Okay.
complaint आते हैं like with the breast mass,
Then you would
we
go
are
with the
difficult to find. Yeah, we are difficult to know whether it is fibroadenoma, fibrocystic. We can go for ultrasound.
Okay. Usually when somebody comes to you with the breast mass, so if the age of the patient is less than 30 years of the age, then you would go with the ultrasound and then mammogram. If even the patient is of the 30 year and there is a mass and there are constitutional symptom as well, and you on the basis of your physical examination, you are suspecting cancer, then for sure you would go first with the mammogram. Okay. And if the age of the patient is more than 30 years with the breast mass, then first you would go with the mammogram. Go with the mammogram. For example, here is the case. This is the typical case of intraductal papilloma. Intraductal papilloma. The investigation of the choice would be mammogram. For the intraductal papilloma, the investigation choice would be mammogram. Again, a 32-year-old female complaining of the left breast mass with a bloody discharge. Intraductal papilloma. Investigation of the choice would be mammogram. 37 is the age of the patient with family history. Now, family history highlighted word. Complaining of the breast mass. There is a breast mass plus positive family history. And she was concerned about the breast cancer. Okay. So, there are skin changes, skin teething. Patient is having symptoms that are suspected case of malignancy. So you would go with the mammogram. You would go with the mammogram. Okay. Now, 35 pregnancy. Whenever pregnant female presents with the breast mass, go with the ultrasound. You would not go with the mammogram unless until there is strong indication. With the shields, then we go with the mammogram. Otherwise, no. We would go with the breast ultrasound. Pregnant lady come with the bilateral breast tenderness and the mass, go with the ultrasound. Pregnant patient with the breast mass, ultrasound. Breast mass behind the nipple on ultrasound, already ultrasound done. There is hypoechoic lesion. Hypoechoic lesion. What would you go next? Yes. What do you mean by hypoechoic lesion?
If it is fluid filled, then in
Yes,
ultrasound
it means there is a
hypo,
collection.
hypoechoic.
Excellent. There is a collection. There is a soft lump. You would go with the FNAC. You would go with the FNAC because if there was a hard mass, go a young patient ultrasound and then biopsy. But cystic changes, go with the FNAC, hypoechoic lesion. Pregnant lady breast mass ultrasound. Increasing breast mass 3 to 4 centimeter. Young patient, pregnant lady, go with the ultrasound. Breast screening, how frequent? Okay, how frequent? Every 2 years. This every 2 years is advice for which age? अभी जो भेजा है टेबल, यस शाबाश। यंग पेशेंट, शाबाश। स्पीकर,
Breast screening, ma'am.
breast screening, how frequent? Direct, there probably there would be some they should have mentioned that patient is having a mass or not, there is a family history or not. They're very open-ended question that breast screening, how frequent would be required. If it is an open-ended question, then for the patient, like age is young, the the age frame is from 40 to 50 years, 49 years are the age, then mammogram every 2 years, then mammogram every 2 years, especially if there is no family history. If there is a family history, then every 1 year. A breast mass, periolar nipple pulled inside. Now inverted nipple with the breast mass. Unilateral. What next step? What is this case? Ductal ectasia. Typical case of ductal ectasia. What would you go? First of all, we need the screening test, imaging. What imaging? Ultrasound, mammogram. Then go with the core biopsy. Then staging would be required. This is the stepwise management of the ductal ectasia. 37-year-old female with the family history. Now there is a family history. There is a mass. Same question. Skin teething. Going in the favor of cancer. Go with the mammogram. Go with the mammogram and then biopsy. Female patient going for the breast examination, but she wants the female doctor to examine. We would respect. Even the ethics say, if being clinician, you are male and you are supposed to examine the female patient, you would take the consent and you would examine in the presence of the female nurse. Breast pain, pre-menses by 3 days, and examination is normal. Nothing to do, reassurance. These are the cystic changes in the PMS. Okay. And you would examine the patient for next cycle. Strong family history of the breast cancer come with the identified breast mass. Strong family history, go with the mammogram. No family history, young patient, ultrasound. Strongest risk factor for the breast cancer in the female. Age or genetic? Yes. Family history, risk factor है बड़ा कि age है? What is the biggest risk factor for the breast cancer?
मैम ये क्वेश्चन मुझे हमेशा कंट्रोवर्शियल ऐसे होता है मैम, like risk factor
Yes,
for
Majid
breast
and
cancer.
Ronak.
Genetics will be the first
Huh?
no ma'am, next only the age.
Hmm.
Genetics will be the first option.
No, age. For sure, age. Above 50, that is the chances of the breast cancer in the menopausal women. First risk factor, age, and the second is the family history. Got it? A young woman with the
Yes, ma'am.
with the painful breast lump, redness, tenderness, typical sign symptom of inflammation. Patient is febrile. Case of abscess. If the size is 5 or more, go with the incision drainage. Less size, go with the antibiotics. A 50-year-old lady presents with a bloody nipple discharge. Number 1, age is 50. It was found to have invasive intraductal papilloma. They have mentioned that patient is having cancer, intraductal papilloma. What is the management of intraductal papilloma? wide local excision. Maximum of the cancerous tissue you would remove. What is the difference between the wide local excision and the simple mastectomy? Wide local excision, you would remove cancer, maximum large size tumor. You would remove maximum tissue of the cancer with only a small portion of the breast tissue and leaving behind the rest of the tissue. Okay? Got it? A patient with the bloody stained nipple discharge. You are suspecting intraductal papilloma. What is the next step? Okay. If you are suspecting, it is hence not proven. Go with the biopsy first and then wide local excision. First of all, biopsy would be required. Color of the discharge in the intraductal, always bloody. In the case of intraductal papilloma, there would be bloody discharge from the nipple. Ductal ectasia, there would be pussy discharge, yellow to green in the color. Take a screenshot, please, and share in the group. Ductal ectasia, yellow to green in the color. Ductal papilloma cancer, go with the bloody discharge, red color. A breast biopsy shows intraductal papilloma. What would you go? Wide local excision, breast conserving surgery. What is this breast preserving surgery? Remove the maximum of the cancer tissue with the small portion of the breast tissue. Breast biopsy show again management, breast preserving, wide local excision surgery. Now again, please take a screenshot of this box and share it in the group. Padma, now you won't forget what I have explained just in the previous questions. Here is the summary. Okay, when somebody comes to you with the breast mass, you would take the detailed history and go with the physical examination.